Very much. Good afternoon, everyone, and welcome to our COVID-19 update talk. We have a great pleasure of having Josh Hands as a coordinator of Rockland County Hatzolah. First of all, thank you for your time. I'm sure you're extremely busy now. And I want to thank all your members and the organization for doing such fantastic work all year round, year after year. And particularly, I was very heartened to see the flyers that you've been sending the last couple of weeks. The last one was in association with many organizations and the stores and mentioning about COVID-19. And because there are some often swirls of information out, information or maybe misinformation or incorrect information, I really thought that our community was very much benefit from hearing from you. So tell me what's it like? What are the case numbers like? What's it like? Please go ahead.
Well, again, you referenced the communication that Hatzolah had sent out last week, and I just want to point out as well that Hatzolah sent out pretty consistent communication over the past several months. We haven't inundated people with it recently, but the message has been pretty consistent that we are always recommending that people are following the appropriate guidelines, because we want to be able to not have to respond. We all yearn for the day that Hatzolah is out of business and we have no calls to go to. So we really want that people should use some common sense and follow the basic guidelines that are being asked to be followed to prevent people from getting sick. And we're trying to just remind people. It's a part of Hatzolah's job is to, also we're a community-based organization, which of course responds for emergencies, but we're there for the community and trying to help out with these various issues. And obviously this is a big issue for the community, and we're there to help remind people of these basic things, because Baruch Hashem, things did settle down very, very much, between what happened for Pesach and over the past, I would call it 2 weeks. It was a big, relief for everybody, and everyone became. It's hard. It's very, very hard for everyone in the community, Hatzolah members, no exception, to maintain that very high level of awareness. It's almost impossible.
Right.
So we try to remind people, because unfortunately from our side, we started seeing little spikes of cases, and where things really leveled off and there were Baruch Hashem very, very few and far between, we started responding to some people who were sick. And Baruch Hashem, the first bit of good news I could share is that even though we started responding to people who were sick, the level of acuity, of the severity of their illness was much, much less than it was the last time. However, these were still people who were sick, who were still having symptoms. And unfortunately, over the past week, we've really had to have a big increase in the amount of calls that we've gone on for people who are sick. And again, maybe Baruch Hashem not as sick as they were last time, but still sick. And unfortunately, many of these people we had to take in for further treatment to the hospital, which is important to remember that, people like to say and harp on the words, oh, it's not as bad as last time. For a person who's sick, it's just as bad as last time. They don't care about last time. They only right now, them or their family is undergoing a tremendous, nisayon that they have to deal with.
My brother-in-law says that the only minor surgery is someone else's.
It's 100% true. So
So
that's why I don't want people to, even though, yes, I can tell you from a perspective of Hatzolah that Baruch Hashem, the patients that we're coming to are not, it's a milder, but that doesn't mean that it's not affecting people to the point that they need treatment. But again, the promising news is that there are better treatments available. There's a better approach available with the doctors, with the hospitals. So these people that we are transporting, for the most part, are getting treatment and are getting better and are going back home.
Right. I
And
just, there was someone I know very, very close to our family that really had a very, very severe case. So, there's some of that also. So I think what you mentioned when we were chatting yesterday, um, that you mentioned to me that during the first COVID, Purim Pesach, as you were talking, that people were often reluctant to go to hospitals, and therefore your message of things are thankfully better in the house. We've had more experience dealing with it, that people should call in and shouldn't be concerned about being seen and being treated.
correct. So the first and foremost is people should never hesitate. First of all, you should be in touch with a doctor. If you're not feeling well, you should be reaching out to your doctor. That's the first point of contact. But people shouldn't hesitate to call Hatzolah and to if they're ill, we could take you to places where you're going to be able to get better. There was a tremendous fear, and we understood the fear the first time. People were going to hospitals, people were going in, and unfortunately, were not always coming out. And it was a very, very scary time for everyone. The fear still remains because there's a big challenge with many hospitals about family members being able to be bedside with a patient the entire time, and that's very painful and very difficult, especially with it's an elderly family member, and it hurts the family so much, and they really have this tremendous fear of having the family go in, and we don't minimize that. But what we are saying is that there are treatments available for these patients. People are getting better and are going back home. So don't hesitate. Don't stay at home and feel I'm helpless. I can't go anywhere. I'm not going to call anyone. You can call. We are going to try to help you. We are going to try to direct you to the best possible hospital at the time for the best possible care for each and every person.
And when you said, I just want to amplify your thoughts. What you said about preventative measures. You were speaking earlier about the importance of avoiding that. That's one of Hatzolah's main missions, is to avoid these tragedies in the first place. You're referring to masks and social distancing.
I'm referring to those guidelines that have been asked of all of us, that we have to, first of all, if someone's not feeling well, they have to understand you have to be staying home. That I think is, it's common sense, but people have to realize it's so important, because if you're not feeling well, or someone in your family's not feeling well, you should be staying home. As far as wearing masks, I know it's a very hotly debated subject, and the basic idea is we were given guidelines by the state. Hatzolah follows those guidelines. Hatzolah wasn't given an option. We didn't give a choice. When you go and respond as a member of Hatzolah to an emergency, you have to wear a mask. So there are certain guidelines that were given to all the people, that when you're in certain places where you can't practice social distancing, you have to wear a mask.
Look
We
at,
have to go ahead and
the
follow
thing that
the rules.
I'm sorry, the thing that really bewilders me is that, when you're evaluating opening a school, closing a school, opening a business, closing business, there's a risk reward. There's a benefit and there's a downside. There is no downside to wearing a mask. There's no downside to practicing the type of behavior that could save lives. I really think we have to, I davened in a shul. I davened in Rabbi Gottlieb's shul in Beis Torah, Rabbi Wein's old shul. I davened outside in the tent. They rented a very large tent. It was outdoors, and everybody wore masks the entire time. And, nobody, I really think that's the way to go. I don't even see, I don't even understand I don't even understand the opposition to it. Unfortunately, it's become such a political issue. Um, what would you have any advice as far as families now with Sukkot coming?
So I really, it's not our place to advise. I know it's a very common question. I'm sure you get it,
We're,
maybe
we're
as a
doing
rub,
we're,
or
we're reevaluating ourselves right now with our own grandchildren.
right. So that really has to be a question each family has to decide. We can't say don't go, do go. Every family is different. I know in my own family, I can only speak for myself. I can't speak on behalf of the organization. My own family, we're being very cautious, and we're each each section of the family is really having their own sukkahs. This is a year where I don't think my wife anticipated. We're making our own Pesach, our own
Right,
Shavuot,
exactly.
and Sukkot. We're going, we like to be together with family. We want to be together with family. And Mirz Hashem, we will. But for right now, we're making the most of it
And
in our own family.
we reconsidered also, in light of the spike recently, we were actually considering a setup where we would have been able to distance more and with one of our children, one of our married kids, and we decided to stay home. My wife Uri and I decided to stay home. It's just, the drumbeat of the increasing number of cases is really getting us unsettled.
That's something, again, every family has
Right,
to
every family for
work for
sure.
themselves. But again, it's common sense. If someone's not feeling well, you have to realize, even though it might be difficult, that okay, it's going to be an inconvenience. We have to just work through it and work through it together. And that's something I just can't stress enough.
And
we have to exercise common sense and good judgment.
And again, just to review what you said about the uptick, the sense in the community was that after that horrible Purim Pesach, as you said, in the couple of weeks afterwards, there's been a lull for a few months, but clearly, I'm hearing from you that there is a significant rise in cases now over the past couple of weeks.
Correct. So over the past week, really, we've seen a significant number of transports of people that we've taken in for, directly related to COVID, not having COVID as a secondary issue. And the type of call numbers that we're seeing, the last time we've seen these call numbers were mid-April, which was, really Baruch Hashem a while ago, but it's really bringing us back to what's going on there. And we've taken people in to a variety of hospitals. Each person is evaluated on their circumstance, and we try to be as literally up to the minute information about the hospitals as possible to make sure that every person's taken somewhere where they can get the best care for them. But I was on the phone with one of the hospitals yesterday in the morning, and they said, oh, we haven't had any real COVID cases since June. That was yesterday morning. And I can tell you that as of midnight last night, they had 3 COVID cases.
Wow.
Because we brought them in.
They haven't had any since June, and then they got 3
correct.
in the past 24 hours.
They haven't had any admissions since June, and we brought them 3 yesterday.
3 yesterday in a period of less than a day.
Less than 12 hours.
Less than 12 hours. My wife and I on Yom Kippur and on Shabbos, I live on Briarcliff. West Maple is back to back with, is parallel to us, and that one. My wife started a customer a little while ago to say Kapitel Tillim when Hatzolah ambulance goes by, and I picked it up from her, and we do it. And that Shabbos, that back then, I think, it was just almost nonstop. And we did notice an uptick in the sirens going by in Shabbos and Yom Kippur. So I'm going to do my very best to get the message out. Josh, Gebench Design, thank you for your work. Thank you.
Thank you. And I just leave that as we always wish for everyone that we honestly, obviously, all the things that everyone's doing throughout the community, not only Hatzolah, but everyone that's trying, these should stand as schussim for our community. And we look forward to the day, honestly, where we do not need Hatzolah. We want to be out of business. So please.
Thank you very much. Josh, thank you. Hashem should give you mazel and bracha. Thank you for taking time from your busy day. I really appreciate it. Be well.